You're listening to On the Ear, an audiology podcast sponsored by SpeechTherapyPD.com. I'm your host, Dr. Dakota Sharp, AUD, CCCA, audiologist, clinical professor, and lifelong learner. While I primarily work with pediatric cochlear implants and hearing aids, I am absolutely intrigued by the many areas of audiology and communication in general. This podcast aims to explore the science of hearing, balance, and communication with a variety of experts in hopes of equipping you to better serve your patients, colleagues, and students. So let's go. We are live and on the ear, brought to you by SpeechTherapyPD.com. In June of 2021, I had the privilege of interviewing Amanda Devereaux of the National CMV Foundation to discuss some of the initiatives their organization was leading for congenital CMV screenings for newborns. Since then, there has been some fantastic progress as well as an expanded understanding of the role of cCMV in children with developmental delays and behavioral difficulties. Today's guest is here to refresh our understanding and advocacy for cCMV. Dr. Megan Pesch is a board-certified developmental and behavioral pediatrician and researcher from Ann Arbor, Michigan. A graduate of the University of Michigan Medical School, her clinical work focuses on evaluating and treating children with developmental delays, autism spectrum disorders, and behavioral difficulties, including those with congenital CMV. She founded the Michigan CMV Project to increase awareness about CMV prevention in the Ann Arbor area, and she is inspired by her daughter who was born with congenital CMV. She is past president of the National CMV Foundation and shares fantastic information and resources on her Dr. CMV Mom social media page. That's how I discovered her and all the great work she's doing. Just a couple of financial disclosures. I'm host of On the Ear and receive compensation from SpeechTherapyPD.com, and Dr. Pesch received compensation for her contributions to this presentation. Well, welcome, Megan. I am so glad you are here. This is going to be such a fun conversation. It's been a couple years since we've refreshed on CMV, so I'm hoping you've got some good info for us.
Oh, I've got tons. Thank you so much for having me. And it's great to be able to talk to you and your audience because audiologists are my people. I'm always so in awe of them. So it's really great to be able to talk to you today.
Absolutely. And a lot of the spaces I'm in with other friends in healthcare, nurses, I have a friend who's a psychiatrist and things. I feel like audiologists, we learn about CMV in school and we definitely see its impacts, right? I have so many children on my caseload. I specifically work with pediatric cochlear implants. So many kids on my caseload who have a diagnosis of cCMV as the etiology for their hearing loss. And yet people in other healthcare domains have never heard of it. I have friends who are in nursing and have no idea. And it doesn't just impact, their care potentially, but also their role as a parent potentially as well too. So it's so widespread and yet still so not well known.
Yeah, you're totally right. It's wild how few people have heard about congenital CMV. And honestly, myself included, before my daughter was born. It's not something we're really taught about in medical school. I mean, yes, like that. I knew that congenital CMV existed, but how it was transmitted and who was at risk and all of that, never ever covered. And it's actually not something that's covered in most OBGYN's training either.
Yeah.
So it's really just, we've got a lot of work to do in terms of education and advocacy.
Well, I know you've done a lot of work in that space in education and advocacy. So I'm curious, what led you in there? I know you have a daughter with cCMV. Did this start before that or after, or what was kind of your journey into this space?
Yeah, so my daughter was born in 2018. And so up until that point, I saw patients with autism and ADHD, and I would just get kids referred for behavior problem and evaluating their development. And my research was actually in pediatric obesity so far from anything infectious disease related. But then when my daughter was born, it was a fine pregnancy. It was great. I had 2 other little ones at home at the time, but there was absolutely no concerns. In the hospital, she didn't pass her newborn hearing screen on both sides, but it was a rough delivery and she had meconium and gunk in her ears.
Oh my goodness.
And so having worked before as a pediatrician in the newborn nursery and having reassured so many moms myself to say it probably is fluid, which I mean, statistically speaking, most of the time it probably is fluid, right?
Yeah. My audiology senses are tingling though. I'm like, no. But I only see the other side of that. I don't see the passes. I see the ones after. But yeah, I'm totally with you there.
Yeah, so we took her home and loved on her, and she was great, great little feeder and sleeper. And at when we did bring her home from the hospital, she did startle at that times. Like
Mhm.
she had two sisters that were running
It was
around,
a
and so
noisy place. Yeah, fair enough.
yeah, so we were like, I'm not gonna worry. But when her name's Odessa, when Odessa was 2.5 months old, I went in for the repeat, or not, it wasn't a repeat screen because they did two screens in the hospital. So it was the diagnostic. And we found out she had profound bilateral sensorineural hearing loss,
Oh my
which
gosh, what a
was,
surprise.
it was such a surprise. And, just that's a conversation for
Yeah,
another day.
no,
A
that's a
parent,
great
like,
podcast conversation. You know what I mean? And we've had other parents in the past kind of talk through that journey, which I'm sure as a pediatrician is a completely different perspective on what that journey looked like for you.
yeah, it was wild. And all I could think about was all these things that could cause hearing loss. I'm like going
Hmm.
down my differential diagnosis.
Sure, sure.
And I'm like, oh, could this be like a tumor? Could it be all
Yeah.
these things? And on that list was CMV. And we were so privileged to get in to see a great ENT and had
Hmm.
repeat diagnostic testing like within the week. And they said this is probably genetic. And she looked great. And
Sure.
we were like, well, and again, statistically speaking, it probably was genetic, you
Totally.
would think. But at that time, I asked about CMV, and at that time, she was 2.5 months old. So it's kind of a little too late to do CMV testing. And that's because if you test for the virus when babies are older than 21 days old, yes, the virus can show up in their urine or saliva or blood, but you don't know if it's just like a CMV cold or
Hmm.
CMV's everywhere. Like it's in
Sure.
breast milk. And honestly, if a baby catches CMV after they're born, no big deal.
Hmm.
So what we had to do was really advocate to we got her urine tested and it had tons of CMV in it. And then we had to go request her dried blood spot from the state. And so in Michigan, they save the dried blood spots for years and years afterwards. I mean, it had only been a few months, and we sent
Sure.
that to get it tested. And lo and behold, like this kid had congenital CMV.
Yeah.
And it was so shocking. And really, with all my training, I had been staring at symptomatic congenital CMV 24/7 for 2.5 months, and not once did it cross my mind.
Sure.
And it really made me think, as a parent, you're like, oh, all these like missed opportunities. And looking back, thinking like, oh, she probably would have benefited from antivirals and maybe we could have saved some hearing. And although the woulda, shouldas,
Sure.
but also, oh my gosh, like, of course this happened. Of course this happened. Who would have thought this baby had CMV by looking at her?
Totally.
And so it honestly, in her first year of life was a bit of a blur for me. I was just in mom mode.
Yeah.
We pursued cochlear implants and going
Hmm.
down that whole rabbit hole, and
Sure.
she needed a lot of developmental support. But when she was around a year, I kind of surfaced and was like, hey, we can do better than this.
Yeah,
We
yeah.
can we can screen and we can tell pregnant people or people who may become pregnant about CMV and potentially catch or potentially help prevent it or at least catch
Hmm.
it early.
Yeah.
Because I felt like if I didn't know about CMV, nobody, like
Yeah, yeah,
nobody
yeah.
would know.
That's fair.
So that's a very long-winded answer to
No.
how I got into CMV.
No, that's really, really fascinating. I think that's like that's the whole episode right there is really your story through that because and that really is the reality for so many families. I mean, I had a close friend who was just about to have their first child, and I for all of my friends who have babies, and when I teach students too, I did a lecture for I don't it was like the Society of birth issues research or something, and
Yeah,
it was supposed
sure.
to be about hearing loss, right? And I
Hmm.
still put in one slide on CMV because I'm like,
Yeah,
somebody here is going to hear this for the first time, and I like have to say something. So
I
I had a
love
friend
that.
who I was telling about this. His wife is a nurse, and I was like, they've been foster parents the whole time she was pregnant. And I was like, you're at a higher risk. I know you're a nurse, you probably wash your hands all the time, but you're at a higher risk, and you probably should just ask right after she's born if they can just screen for it because that's the only time you can really do it. And they're like, okay, like we'll totally do that, yeah, for sure. And they said they got so much pushback in the
Oh,
nursery, and
oh
people are like,
no.
what are you so worried about? And I'm like, and so I feel like I'm scaring them, and then their providers are making
Right.
them feel like they're crazy. And I'm like, this is terrible for everybody. We need to
Yeah.
come to a consensus here. I'm curious, were there any, as a person who's a professional in that space, you probably didn't have as many people questioning you because you were truly an expert in
Right.
this field, right? But I'm curious, did you have any experiences like that where you were pushing for more answers and maybe you were getting pushed back from people in your own field?
Definitely. Well, I I have to say I didn't have some sixth sense. I wasn't like, "Oh, I just feel this is CMV." I was just like grasping
Yeah,
for straws. And I did get pushback about it because she looks not like huge pushback, but I remember them saying she looks so good. We
sure.
would expect her to look ill if she had congenital CMV, which is this misconception. It's really only 5% of the babies with congenital CMV are sickly or need to be
Hmm.
in the NICU or look, have anything on physical exam that you can pick up on. It's really low. There's sometimes babies will have a few petechiae or be
Hmm.
small, but like a lot of babies are small and a lot
Sure.
of babies have petechiae. So yeah, I did get some pushback and there wasn't they didn't really know. My team didn't know at that time how to order CMV testing from the state and who to contact.
Sure.
And I just feel, even though we found out later than I would have liked, I do feel so lucky that she did get a diagnosis, which is because of like the privilege of having a mom that knew the people to contact
Yeah,
and
yeah.
knew the system. So yeah, and I have to say, so I have a hack for your friend who got pushed back in the
Yes, please.
newborn nursery. So CMV it's a virus that's everywhere. About
Hmm.
50% of people have had it by the time they're like 40. It's spread through any bodily fluids. Like I know it's kind of gross, but
Yeah.
like from kissing, from
Hmm.
sharing food, from anything. And so that's why people spread it around so readily. It's generally no big deal, except if you catch it in pregnancy or have a reactivation of an old infection. And then that virus can get transmitted to the growing fetus. And that's when it's dangerous for the growing fetus.
Hmm.
Anyways, it is such a common virus that if you just say, I was exposed to CMV in pregnancy, which
Ooh,
you were because
true.
somebody walked by you with CMV.
A
So
thousand
just stick
percent.
to
Yeah.
that. Just say, I
Yeah.
was exposed to CMV in pregnancy multiple times or whatever.
Yeah,
And
yeah.
then that they have to order it.
Oh, that's so good to know. That's like just helpful advice, I think. And
Yeah,
most people don't know how to, it's intimidating to ask for care that your
sure.
doctor's not recommending. It's I don't want to feel like I'm the expert here. I don't think I should have to ask for something my doctor isn't recommending. I mean that's a fair perspective, but I think this is also a perspective that people have because it's not as well understood yet, at least, universally. So yeah,
You're
I
totally
appreciate
right.
that tip. That's a great way for people to approach that question because it is true and it's I think a good way to, ask for the care that you need there. You kind of hinted at it a little bit there. I'm
Mm.
not sure how much I know your research is more into the more consequences of congenital CMV and what we see in development. I'm curious if you could give us kind of like your briefest med school lecture on what's happening in the body when
Oh,
CCMV is
yeah.
transmitted and like how I know there can be organs that are a larger size, petechias, symptom. What's going on in the body and with hearing loss too, if you wanted to connect it to that as well. I'm sure
Sure.
once you found out, I'm sure you went down a rabbit hole that none of us have had the chance to go down before.
I hate this virus and I have such respect for it too, because it's just unbelievable how
Mm,
this virus works in the human body. And it's truly astounding that any of these children, any of these fetuses survive.
yeah.
Um, so what happens is if someone catches CMV, either for the first time when they're pregnant, that's called a primary infection, or well, I guess I should back up. When a person catches CMV for the first time, that's called a primary infection. Usually that person doesn't get any symptoms. Like it's that much of a no big deal virus. If you're immunocompromised, if you have cancer, if you're on chemo, that's different. But for most folks, they don't even get cold-like symptoms. But the virus, it's kind of like the chickenpox virus. It goes dormant in your body and is there for the rest of your life. And occasionally it will reactivate over time. And when it reactivates, again, most people get zero symptoms, and that's called a non-primary infection. But the
Okay.
virus is in the bloodstream again.
Do you have
So
to have been exposed to get a non-primary activation, or is it just it randomly just happens one day years later?
it it happens. Stressors, so
Okay.
pregnancy
Mm.
can certainly do
That's
that.
stressful? Pregnancy is
Yeah,
stressful?
right? It's no big deal. So yeah, anything stressors or just kind of randomly throughout someone's life, which
Hmm.
again is why it's so easy to spread because you wouldn't know you were sick. I mean, you don't really have any sick symptoms. So if the virus is circulating in a mom's bloodstream and
Hmm.
she is the virus can actually there are three main ways it injures a growing fetus.
Okay.
So the first way is it ramps up mom's inflammation and mom's like immune system that is fighting back and go mom, that's good. So
It's awesome.
right. So all those, white blood cells and cytokines and like everything's getting ramped up to fight down this infection. And a little bit of inflammation is good. We want the infection to be fought, but for developing fetal brain that is
Hmm.
very sensitive to that, the inflammation can cause damage to that developing fetus.
Okay.
So that's one way. The second way is CMV attacks the placenta. So it gets in there. It actually has been shown to mutate and change some of the receptor cells that bind the placenta, like mom side to baby side, and can cause like
Interesting.
placental detachment.
Wow. Okay.
It causes like the blood vessels in the placenta get really thick sometimes. So
Hmm.
baby's getting less blood flow.
Yeah.
And then the virus also it loves the fetal CNS, the fetal brain cells.
Wow.
So it gets in there and it depends when you catch it in pregnancy or when it's
Okay.
in the bloodstream. So early on, that little fetal brain, we've all seen the pictures where they look like little tadpoles and then
Uh-huh.
they're
Uh-huh.
starting to develop. So those are like very early cells that are dividing and will continue to divide and
Hmm.
grow into this beautiful brain. But early on in pregnancy, if that brain hasn't fully developed, which it isn't in early pregnancy, and CMV gets into those cells and causes some variations, changes how those cells grow,
Hmm.
then parts of the brain will either not develop or develop in an abnormal way.
Okay.
Yeah. So all that like downstream development later on in pregnancy
Hmm.
can go awry if some of those initial foundational pieces aren't there. So, and later in pregnancy, CMV can still get into the fetal brain, and it's then the immune system is fighting it off. We've heard
Hmm.
about babies with calcifications seen in their
Yeah.
brain,
Yeah.
and that's kind of like the leftover of the battle between the immune
Interesting.
system, the
Yeah.
white blood cells, and the virus in the brain. And that's kind of like the destruction after the battles of just trying to win back those cells.
Yeah.
So, whenever you have a baby with any kind of brain injury or decreased blood flow or,
Hmm.
you know, inflammation early on, then they're at risk for all these neurodevelopmental sequelae is kind of the long term, but
Yeah. Yeah.
developmental delays and disabilities that all really stem from either having visible brain differences, because
Hmm.
sometimes you can see how the brain formed differently, or sometimes we don't see a visible brain difference, but these
Yeah.
kids are at higher risk of autism and learning disabilities and things like that. They're a little bit softer in terms of not as serious as, say, epilepsy or it really involves cerebral palsy, but still significant and they
Sure. Sure.
impact.
Yeah,
Yeah,
absolutely. And that progressive hearing loss that doesn't come for years later, and we can assume that we could
right.
attribute it to that congenital CMV that wasn't known about at the time, right?
Yeah, and the hearing loss piece is still such a mystery because why everything else in CMV, and this is a bit crude, but the damage that is done in utero the damage is done.
Mm-hmm.
So we don't usually see, a progression of the illness, or like a baby is born with the brain that they're born with.
Mm-hmm.
So if a baby is going to have cerebral palsy, you can track it back to having that change in their brain in utero. But these babies have beautiful looking ears on imaging.
Yeah.
Like, why? Why do some babies have hearing loss at birth? Why
Mm-hmm.
does it sometimes fluctuate? Why, like, sometimes these kids go along having nothing, and like nothing in terms of a hearing loss, and then
Yeah.
bam, at 5 it almost is like they lose a unilateral, like they go from nothing to profound in a matter of
Yeah.
months. It's, people hypothesize that it has to do with the vasculature of the inner ear.
Interesting.
And I'm not saying that isn't true, but
Mm-hmm.
the delayed onset is so odd. People have looked to see, is it associated with a reactivation of the infection,
Sure.
perhaps? And even when kids are starting to decline and we hit them later on with antivirals, which is absolutely not recommended, just, people have tried it as like a
Sure.
Hail
Sure.
Mary, it doesn't help. Or giving these kids
Interesting.
steroids. Is it inflammation? Is it
Yeah.
so that mechanism it's really unsatisfying answer.
Yeah. Well, this is like just out of random curiosity because I
Yeah.
know the vasculature of the inner ear is somewhat similar to the vasculature of the kidneys. That's why we have some like overlap in kidney disease and ear disease. Are these kids having kidney issues later in life? These that have this progressive hearing loss? Is that not really a concern?
We do see a few more kidney issues in kids with CMV than kids without. It's not something that's super common. We don't
Okay.
see late life kidney malfunction. Sometimes these kids they just like genital urinary, let me try that
Hmm.
again. Genital urinary malformations seem to be more common in this population.
Interesting.
Um, but everything else, the just delayed onset and progressive nature of the hearing loss is
Hmm.
just so peculiar and is so hard to monitor for,
Hmm.
right? If we only knew which of these kids would be at the highest risk or at a risk of hearing loss, because
Sure.
what is it, like 1 in 5 of kids with
Hmm.
CMV? And I mean, we do know that babies who are born with obvious brain involvement, who are sick at birth. We call those babies symptomatic. The babies who you look at and you can say, oh, that baby has a smaller head or
Hmm.
petechiae. They've got an enlarged liver, which the liver is caused from just the virus getting in there and infecting those liver cells. And so it gets
Wow.
really big and
That's
swollen.
the cytomegalo, right? Like the cell large
Yeah,
cytomegalo. That's what's happening there, right?
they're really big cells. Yep.
Interesting.
Yeah, but all of that, like you don't see kids with congenital CMV getting liver problems down the line if they
Sure,
never
yeah.
had it. So what is it about the inner ear? I don't know.
Oh my goodness. Well, I'm hoping you'll find that answer for us soon.
Right.
I see so many of these kids and I see so many kids with these late onset progressive hearing losses. So I went through, we have a database where I work and we keep track of all of the kids that we see. And I went through today and I just said, okay, how many, because I knew we were going to be talking about CMV and autism. And I was like, how many have CMV and either autism or have been evaluated for autism in the past? Not other, there's a lot of other categories I could have looked at too, but I tried to keep it really simple. And in that database, I had almost 100 kids with that crossover,
Wow.
right? A variety of ages. And then I had, well, sorry, that's not exactly true. That was, I think CMV and autism was probably like near 30s to 50s. Then
Hmm.
I said etiology unknown and also has symptoms like autism, which I can't say all of these kids have CMV, but man, does my gut feel like every time I see one of these kids,
Yes.
we don't know when your onset was. You maybe you had, no concerns at birth, but like you're kind of smaller in stature. Like you have autism. There's these things that they kind of gives me a feeling that nobody was able to ever
Yes.
catch CMV for you, but I could never, know for sure. At this point, it's too late. You're now 8 and your blood spot's gone and there's no way to really test for it. So
Hmm.
there's definitely that connection is there, this hearing
Yeah.
loss, this brain involvement, cCMV. But I'm so hopeful we will soon just uncover that link, I guess.
Yeah. And, just CMV screening is becoming more and more common. But when my daughter was born 6 years ago, at my amazing, academic healthcare institution where she was born, they weren't testing for CMV, even in the
Hmm.
kids with known sensory neural hearing loss. And I think
Sure.
like more and more we're testing, but we just didn't test back in the day.
Yeah.
And depending on what state you live in, you can go back and request the dried blood spot. And it varies for different states how long they keep it. In Michigan, we keep them 35 years. So
Wow.
I know,
That's a
which
long time.
is
That's great.
yeah. So I feel like a bit of a detective sometimes when I can be like,
Combing through the
bam,
files, it's like a file cabinet full of blood spot cards and hole
total,
punches.
totally. But it is like wild to go back
Yeah.
and look. Or sometimes when we suspect if there were some complications at birth, sometimes they will have sent mom's placenta to the pathology lab to look at. And this is in mom's chart, it's not in the baby's chart.
Interesting.
And the pathologist will often save this like chunk of placenta. I guess they put it on ice and it's there for years. So I've been able to,
What? That's
I
so,
know,
that's crazy.
I know. So I've been able to request a placenta specimen from these kids. One kiddo, we did it, she was 7 years old. She wasn't born in Michigan. The dried blood spot was gone. And then we had the pathologist test the placenta for CMV, and there it was.
Oh my gosh.
So
That's so cool. I've
yeah,
never heard of
it's
that
really
before, but
fun, right?
that's really cool. What a
Yeah,
way to find it. So actually, before I really want to start diving a little bit more into those kind of involvement, right? The connection between cCMV and some of these other things that we see in kids.
sure.
But before we do, just because there's at least one person listening to this who's never heard of CMV before, and they're like, oh my
Hmm.
gosh, I'm so terrified. What am I supposed to be doing? So, you know
Yes,
what I mean? If it's
right.
avoidable, right? So
Hmm.
what can we tell people out there to know? You did give us a good tip on how to test for it or screen for it at the
Right.
hospital, but what about prior to that? Let's rewind back to I either found out I'm
Totally.
pregnant or I'm not pregnant yet, but I'm hoping to be.
Yeah, absolutely. So what you can do if you are one of those people that plans the pregnancy, which we know 50% of pregnancies in the US are happy blessings, right? Or
Hmm.
surprise
I have
blessings.
2 kids, and one of those is in that 50%, and the
Yeah.
other one is in the other half of the 50%.
Yeah. But if you're planning a pregnancy and go in for a preconception visit, you can request CMV testing. And what they'll do is they'll test the mom's antibody status to see if she's ever had it before. Now, when you get CMV for the first time, the primary infection, that's when it's most likely to transfer to the growing fetus. It depends on when you get it in the pregnancy, but it's something like 30 to 40%.
Hmm.
If you have had CMV in the past, you can still catch another strain. It's like COVID, like you're never
Hmm.
really safe, but you still have some antibodies. So if a mom had had CMV in the past, nothing current, but has those antibodies circulating, if she were to get another strain, the likelihood that it would pass to the baby is like 3%. So it's good to know that at the beginning, like where you are in terms of your
Sure.
risk. This applies to both mom and her partner and anyone around being super, super diligent in terms of hand washing after the use of the bathroom. But actually, what's probably the most important is hand washing, like COVID level hand hygiene after
Hmm.
changing a diaper.
Okay.
Uh, so CMV is, like I said, it's spread in bodily fluids. And what's one place where a lot of bodily fluids are swapped and everywhere? Daycare, right? It's the
Uh-huh.
dirtiest
Yeah.
place. So it's often toddlers or preschoolers in daycare who are, putting the toy in their mouth and then putting it in their friend's mouth and then
Hmm.
snotting on things and all of that. Those kids pass CMV back and forth all the time, and
Hmm.
then they bring it home to mom, or they bring it home to dad, and then dad kisses mom.
Hmm.
So, really, really watching out. CMV, congenital CMV is most often the second or third baby in the family. Because of that, the older sibling is most often in daycare or childcare or preschool or something like that.
Hmm.
So, what you can do is really double down on hand washing. Don't do the thing where you share utensils with your kid. Don't take a lick off their ice cream cone.
Hmm.
Don't,
Even though it's so tempting, right?
I
Or the only
know.
meal you're gonna get that day is the little bits of grilled cheese crust they wouldn't eat.
Yes.
I mean,
Yes,
that was me literally tonight. I ate that crust. You know what I mean?
totally.
Yeah, not a good
And
move. Not a good move.
and a lot of this is just so tough to do. So
Yeah.
I think all you can do is try your best, and you
Hmm.
can say, we are going to try and do this for the pregnancy, but afterwards, we can't live in this kind of bubble. Um, so not sharing your toothbrush with your kid, don't do the thing where
Hmm.
the pacifier falls on the ground and then you like clean it in your mouth and give it to them, you know?
Yeah,
Like
oh
I
man, I don't want to admit that I've been there, but
it's
yeah, I've been
totally
there.
right.
I've been
We've
there.
all done it at like why, but
Yeah.
yeah, we all do it. It's something instinctual about that. And so just really watching those bodily fluids from toddlers and preschoolers in daycare.
Yeah.
And you can ask your OB to recheck your CMV antibodies throughout pregnancy. That way, if you switch, it'll show if you've had a recent infection. And, there are more and more countries, not the US right now, but I think there is a lot more shared decision making in the use of antivirals in pregnancy. So if someone did catch CMV in pregnancy and they knew it, they could probably talk to their doctor about the risks and benefits of antiviral medication to
Interesting. Okay.
decrease the risk of transmission, or even if that didn't feel right for them, just to be super prepared for that baby.
Sure. And definitely, yeah, being not surprised at our hearing screening result, not being, being able to monitor that more closely, even if we pass at birth and things like that into the future. I'm curious. So it does sound like there's thoughts on a treatment option if it is diagnosed or if it's caught early. Before I jump to that, because we were talking about asking for screening and testing beforehand, right, during pregnancy, is that something that you've seen people have some luck with insurance wise? Are we just shouting into the void? Is it if enough of us ask, it will become more of a covered thing, or what are you seeing there?
I've never seen it not covered.
Oh,
I mean,
awesome, awesome.
we check for rubella.
Yeah,
CMV and rubella are like cousins. We check for so many infectious things in pregnancy. Why not CMV?
sure.
Um, some folks get pushback from their OBs. It's not standard in the US, but it's standard in Canada. It's standard in France. It's standard in Israel.
Oh, wow.
So I think if you go to your doctor with that, especially if you say, hey, I'm actually at high risk. I have a 4-year-old at home or
Yeah,
2-year
totally.
old or whatever. I need this for my peace of mind.
Hmm.
I think it's a very strong argument.
Yeah, that's really good to know. I think that's affirming for people who might have also been. They're like, it's one thing to ask for this, but it's another thing if I'm going to get a huge bill for it. But you're totally right. This makes sense as a routine part of pregnancy care. So there's thoughts on some maybe treatment post birth or even during pregnancy. Where are things heading for that?
Sure. So I will say the treatment in pregnancy is not as strongly research based as the
Okay.
treatment after pregnancy. So there have been a few studies in Europe that are really exciting. They're smaller studies though. So, I always say like asterisks or take this with a grain of salt.
Hmm.
But in Europe, what they do is they monitor antibodies every trimester. And if a woman switches from either never having an infection to showing that they have had a CMV infection or a recent infection, then they'll make sure it truly is with an amniocentesis, and
Hmm.
then or they will just start antiviral medication, which in these small studies have been shown to decrease the risk of transmitting the virus to the fetus.
Interesting.
And if the fetus already has the virus, decreasing just the severity of the impact.
Awesome.
So, these are huge. It's the same medication that you would take if someone had like a herpes virus like outbreak in
Hmm.
pregnancy, just at a much higher dose. So,
Yeah.
what I hear from people who take it, and again, this is not like FDA approved for this indication, but I think it's a point for shared decision making with your doctor, if
Yeah.
you are in that situation. And I think the biggest risk is that it's a lot of medicine to just swallow every day. And if you're already prone to being a bit nauseous in pregnancy, it doesn't feel the best for
Yeah.
mom. So um, so that's what can be done in pregnancy. And
Hmm.
then after baby's born, depending on how they are doing or how they're impacted by the virus, antiviral medication may be an option for baby. So,
Cool. Yeah, I have had some babies who
mhm,
had been caught early and then had underwent antiviral treatment with varying. All I'm really monitoring is that hearing progress over time. But
sure.
you know, maybe
Hmm.
that happened and then I'm seeing them like 5 years later and there's a little bit of a hearing loss now. Or what? I don't know. Maybe that's something
Right.
else at this point. You know what I mean? It's like really hard to pin that down so many years later.
Yeah, and the antiviral medications for the babies who qualify, and the babies who qualify, the guidelines recently changed. So it's any baby who is symptomatic, meaning any baby with brain involvement, who was born looking sick, who has a smaller head, who had petechiae, big
Hmm.
liver, those babies, but also babies with isolated sensory neural hearing loss.
Oh
So
wow.
those babies now qualify for antivirals in the States.
Yeah.
And the benefit of the antivirals, the studies have shown, modest improvements in hearing and development at 24 months. But I think even if a child is going to develop a profound hearing loss, if you can kick that can down the road for a year and have more
Totally.
prelingual access to
Yeah.
sound, like that is worth it. So it's the antivirals don't cure CMV or
Hmm.
make a humongous difference like overall, but I guess I feel like even preserving some hearing, delaying, even if the hearing will progress, the hearing loss will progress in time. I mean, I feel like that is a humongous benefit.
Sure.
And what I say to my families is you will never know if it worked or not, right? You
Sure.
don't
Yeah.
have that with your kid. Like you
Yeah.
don't have, and there are side effects. You have to get their blood drawn every week. And that is
Hmm.
like really hard on those little newborn veins.
Yeah.
And so it's a very personal decision for families, but you only have the opportunity to start antivirals. Now they've extended it so the window is up to 13 weeks,
Okay.
but you can't go back and do it, so
Sure.
you can always try.
Okay.
And if it doesn't feel right, if baby's getting refluxy on it or whatnot,
Mm,
then maybe that's not for you, but you can't go back and start it,
fair
obviously.
enough. Yeah,
Yeah.
that's great. I mean, it sounds like things are moving in that direction. I've also heard that there's clinical trials for a potential vaccine for CMV, which I think would be
Yes.
huge in helping with this issue. So that's exciting as well. I don't know if we have any like big updates on that yet, but that feels like that's something in progress. As somebody who's past president of the National CMV Foundation, I feel like that's something y'all definitely had some
Yes.
advocacy efforts in.
Oh yeah, the potential for a vaccine is so exciting. Like going back to the 1980s, or maybe it was even the late 70s, CMV and rubella were like discovered by the same group of folks, and the same group of folks who developed the rubella vaccine, which like we all get, well, most folks get the MMR now, and
Yeah.
we don't see the babies deafened by rubella. That
Hmm.
that like that was the thing up
Sure.
until the 1980s, right? When we started vaccinating and rubella just no longer became a thing in this country. But they've been working on a CMV vaccine ever since that time. And it is just such a
Wow.
tricky virus.
Oh my
It,
goodness.
yes, it mutates, or, it changes, and it's such a stealth virus
Oh my
that
gosh.
clinical trial after clinical trial has not found a vaccine, but there are a couple of candidates in trials right now that are looking very promising. So this is
Good.
still
Good.
under
Okay.
research. Yeah.
Awesome. I'm glad to hear. I mean, that's a long time to be researching something. So I'm glad we're finally having some breakthroughs because that's got to be
Yeah.
frustrating. Awesome.
Yeah. Sorry. Go ahead. Yep.
You're good. You're good. You're good. I wanted to then switch gears a little bit because you
Hmm.
had a huge paper in pediatrics this year, this cohort study on the link between autism and cCMV, looking at how many thousands of kids through
We looked at
CMS?
3 million, 3 million
Whoa!
kids. I
Not even
know.
close in my thousands. Three
Yeah.
million. What can you
Wild,
tell
right?
me? How big was that spreadsheet?
I know, I know. I actually had to get folks from the CDC to help me with the statistics on that and it was really a true
Like, what kind
partnership.
of computer can run? I mean, that is
I know.
crazy. I'm imagining my computer
Yeah.
just on fire trying to like open the file. That's crazy. Okay, so tell me, how did this project kind of get launched and
Yeah.
what'd you guys learn from it?
So After my daughter was born and diagnosed, I started working with the folks at my hospital, my health system, to start screening babies for CMV. And then I just felt, well, I'm a developmental pediatrician. Developmental monitoring is like my bread and butter. So
Hmm.
send them all to me and I will, obsess about their development and make sure they're getting all the right supports. And, IEPs can be tricky for kids with hearing differences and all of that.
Totally. Yeah.
So I started this congenital CMV follow-up clinic, and I just kept seeing these kids being diagnosed with autism. I mean, I would diagnose them with autism, and it just felt like they were just falling out of the, coming out of the woodwork. And I just thought there's got to be a link. And there were some studies, but the studies were really small, and studies that were like, oh, we tested, I'm making this up, 100 kids
Sure.
with autism for CMV and one had it. I'm like, well, yeah, it's actually a pretty common congenital infection. So yeah,
Yeah.
probably one did have it. And that's just, so the studies weren't very robust. So I got connected with a fantastic group of researchers at the CDC who were excited to take on this question. And they had done a lot of CMV research in other areas in the
Cool.
past. And so they were like, yes, absolutely, let's look at this. So the study looked at CMV diagnoses. So kids who have been diagnosed with CMV and kids who have been diagnosed with autism, and found that the kids that having an autism diagnosis was 2.5 times more common in the kids with CMV versus the kids without. Now,
Wow.
those are just the kids who are diagnosed with CMV, which we
For
know is
sure.
the tip of the iceberg.
Yeah.
But yeah, that's what we found, and it wasn't all explained by CNS involvement or brain differences.
Hmm.
And it was autism was relatively more common in the girls with CMV than it was, girls without, of course. And usually we think of autism, at least when we're thinking about genetic causes,
Hmm.
as being more common in boys. So it was neat to see that, which really helped us say there was something else going on here. And yeah, so that was the study.
Oh my gosh. So I mean, that's huge information because I feel like people in this professionally in the space have seen this kind of pattern here, but have never had this data to say, yes, this is definitely, a connection between these
Yeah.
two, this, I was gonna say these two groups of kids, but really this one group of kids, right,
Right.
who have both of these things. I'm wondering if what other involvement did y'all look into anything else with this? Was there any relation to hearing loss or some of those other kind of common symptoms we see with cCMV?
Totally. So the kids who had autism and CMV were so few that we couldn't subdivide them because I wanted to say, oh, was it the symptomatic kids or the asymptomatic
Sure,
kids?
sure.
And then we just ended up losing statistical power.
Okay.
So there wasn't much more that we could say other than like we're seeing it happening more often in this group, which I
Hmm.
think is so important because I mean, everyone in your audience knows that autism is so tricky to diagnose in a kid with a hearing difference, and also like
Absolutely.
vice versa, right?
Yeah,
If you know
totally.
a kid has autism and you're looking for a hearing loss and behavioral testing, it's tricky,
It's
right?
tough. Yeah, definitely.
So if you know to watch out for those signs and symptoms, or now any kid who comes through my clinic with CMV, I'm like, you bought yourself like official autism testing at the age of 2. Like whether you like it or not, like we're
Yeah.
doing it. And I think like I am a big proponent of neurodiversity. I don't
Hmm.
think autism is this terrible thing that we should cure. And I
Sure.
think these kids often need a lot of additional supports. And so that's the lens I look at it. If you know a
Totally.
kiddo is going to need more social supports and language supports, and then let's give them that and help them thrive
And as early
beyond.
as possible, right? Yeah, exactly. And now that
Hmm.
we know that this link is definitely, 2.5 times more likely, like we need to
Yeah.
be extra mindful of that and looking for it in these
It.
kids. Yeah, that's awesome. I was so glad that this is such a huge study and such a well-respected, publication that,
Mm,
pediatricians are going to talk about with families. Hopefully, I just hope it kind of having these two things together, I think really helps shine lights on both of them
I
in a space where a
agree.
lot of parents don't talk about it enough.
Yeah, totally. And it's actually, I mean, ironies of ironies. So my own daughter was diagnosed with autism in the middle of this study. So I can't say it was inspired by her, but it was like Yep, there's another one.
Yeah.
And the more I've gotten to learn about kids with hearing loss and kids who are also on the spectrum, is that like that group is such a setup for language deprivation and
Absolutely.
and not responding to like our typical kind of approaches to maybe language, or you really have to try a lot of things with them. So
Sure.
I think knowing that these kids may be tricky at the get-go is helpful.
Absolutely. I'm curious how you have, I mean, you have so many perspectives. I'm sure you're working with patients and families regularly, right? Not, solely
Hmm.
research, even though your research is
Oh
so
no.
awesome. And I'm curious how much you bring all of this research expertise and information, your personal experience, like how differently has your counseling and working with these families changed over, your career to now? I mean, what does
Oh,
that progression
sure.
look like?
Oh, totally. I mean, you know how I trained for years and years and years, right, to give advice to parents. And after I had my own children, even before Odessa was born with the CMV, I felt like I wanted to call them all and be like, I'm so sorry I told you to sleep when the baby sleeps. Like, I'm so sorry. That was
Oh my
bad
gosh.
advice and
Yeah.
not like I couldn't sleep when the baby slept. Like it was impossible. And the baby didn't sleep. So my perspective has certainly changed over time.
Yeah.
Now I'm very forthcoming with families about my story. And I say over and over, I'm not trying to project on you, and you may not feel this way, but this is what it was like for me. And part of what I do, there's so much worry and heaviness that comes with the CMV diagnosis. And
Yeah.
so try to work with families to say, I am going to obsess over their development, and I
Hmm.
am going to look at those IFSPs, and we're not going to let any more chances or any opportunities go by that could benefit
Wow.
this child. And
Yeah.
and I will make sure that they get a cerebral palsy evaluation or whatever they may need. So maybe you can give some of that worry to me. And
Wow.
I felt like when I was going through it with my daughter, people just didn't know, and they're trying their best, they're doing their best, but these
Mhm.
kids are so tricky. So I have a great team. I'm not just, doing this alone, but
Sure.
hopefully that does, at least families have kind of us as like a home base and people to really be their team as they navigate this.
Yeah, I that is like amazing advice. I'm totally stealing that because I have some kids, with conditions that might cause a progressive hearing loss, and parents worry
Hmm.
every little thing is gonna be the thing.
Yes.
And I'm gonna totally steal that wording there. I'm the person in charge of this. Like, I promise you, I'm thinking about it all the time. You don't have to think about this as
Right.
much. Let that worry go away. You just have fun and live your life. We'll keep an eye on this. That's really, really good. I love that. Okay, so we've talked about kind of counseling families. I'm curious what I know. I'm sure you've taken this on the road. As the president of the National CMV Foundation, you were probably all over the place talking to people. What have your interactions with professionals been like? I mean, I'm sure you talk to people like infectious disease and
Hmm.
pediatrics and audiology and speech and early intervention. I mean, there's so many people that CCMV affects, or so many disciplines, I guess. What's been
Sure.
some of the feedback you've gotten, or any like surprising experiences through all of this, this journey, both as a parent and as a professional? I mean, there's probably so many different people you've interacted with.
Yeah, well, I will go anywhere and talk about CMV. Like at any time, whoever asks me, I'm like, yes, I will be there because people are just not talking about it enough. It's certainly getting better. You know, Audiologists have really spearheaded the CMV screening and the movement, I think. And I think audiologists really need to, I mean, deserve the credit for the screening that we're seeing in more and more states and hospital systems and so forth, because often these programs like rest with the audiologist, or that's like their
Yeah.
home, and
Hmm.
it, like paired with a newborn hearing screen or whatnot. So my interactions with the audiologists have probably been some of the most rich, and I will say I could never. It's like one of the things in medical school where I'm like, I don't understand this. This is not something that I am like. And so I always
Yeah.
so defer to my audiology colleagues and just so respect the field. So that's been really wonderful. I think infectious disease folks are on board. General
Hmm.
pediatricians or like family medicine, like general practitioners, have not uh, generally been so eager.
Interesting.
And I think that's because of a lot of misconceptions about CMV. Oh,
Okay.
we're catching the symptomatic ones already. No, in fact, without a screening program, we probably catch about 1% of all babies with CMV.
Wow, I didn't even realize that.
Yeah, and that's because they
Wow.
all look normal. So why would you
Sure.
test
Sure.
them?
Sure.
It's like
Yeah.
the 1/100 that looks really sick.
Yeah.
So when I've demystified for them, I found that they're open.
Mm-hmm.
Um, the OBGYN community has been trickier. And of course, they're the ideal ones because we don't want to just be, you know, doing the best we can after the damage is done, literally
Mm-hmm.
and figuratively. We want to prevent. And in the US right now, ACOG does not support CMV screening in pregnancy or education. And
Wow.
it's wild. And I don't
Yeah.
place the blame on the OBs themselves because they're not getting educated about this. So
Sure.
if you don't know, you don't know. So
Absolutely.
it's really the professional society that I think needs to get on board, and we're working on them.
Okay, good.
Um, we're working on them because people deserve to know about CMV and people want to know. It's the thing is, if it's too much, if it feels like, these behavioral changes are something you don't want to do during pregnancy, then make the informed decision for your own body. Go for it. Great. That's fine. Just as someone might decide not or to scoop the kitty litter or eat
Yeah,
sushi.
totally.
If you know the risks, then that's fine. And I respect that.
Yeah.
So
But you got to know the
slowly.
risks in the first place to make that decision. Yeah,
Yes,
somebody has to tell you.
exactly.
Yeah.
Exactly.
So we're getting really close to the end of our time. This is maybe the fastest an episode has ever
Oh,
gone by. You were just the
good.
best. So, oh my gosh, I had a bunch of questions left. I got to narrow it down. Okay, so coming up on the end here, I know your time as president of National CMV Foundation is somewhat behind you. I'm not sure how long it's been, but it's not been too long. But you're still a major advocate on social media and through literally the work that you're doing every day.
Mhm.
So I'm curious what has evolved over the last few years in terms of CMV screening and maybe
Mhm.
just like general awareness? And then where do you see us going in the future? What do you think is the 5-year, maybe 10-year plan for CMV screening and awareness in our country?
Yeah, yeah. So I was the president of the National CMV Foundation last year. So I'm still on the board of directors. I'm not at the helm. So it's nice to still be involved. There has been so much progress over the last 5 years. Sometimes I feel like every time I, check my email, there's another state that's introduced legislation
Mm-hmm.
or in the case of Colorado, they just had a very reasonable discussion with their newborn screening board. And they were like, yes, that makes sense. Let's
Mm-hmm.
add it. So we're just seeing more and more states. I think we're up to 12 or 13 states that have some sort of newborn screening initiatives going on for cCMV in their states. And that's all enacted by legislation with the exception of Colorado. What
Mm-hmm.
was really exciting was in 2022 and rolled out in 2023, Minnesota started screening all the babies. So before then, people would really just do hearing targeted screening, which means
Mm-hmm.
if a baby refers on their hearing screen, you buy yourself a CMV test.
Sure.
But that many babies don't refer
Mm-hmm.
on their hearing screen, as we know. So Minnesota started screening all the babies, which was really amazing because many other states have wanted to do this, but no one's really been the first.
Mm-hmm.
And so since then, Connecticut has legislation, and then New York has a pilot study that's going on right now for universal
Cool.
screening, and we're hoping that they're going to continue that. So I think we're going to have more and more screening. And unfortunately, I think that it's this newborn screening that is, in a very backwards way, going to drive awareness because we have done these like public health campaigns, and
Sure, sure.
In Utah, they've had millions of dollars dedicated to public health awareness campaigns for pregnant people about CMV for years and have not moved the needle. But I
Wow.
think once we start to test everyone's going to know someone with a baby with congenital CMV. And in fact, we already do. Everybody knows somebody
Yeah.
with congenital CMV. You just
Whether or
don't
not you
know
know.
it.
Yeah.
Yes.
Yeah.
So I think that's really going to drive awareness. And then the other thing I'm so hopeful for is the vaccine.
Yeah.
And that is just so exciting. And I always say I want CMV to be like the next rubella. Who gets rubella? My hope is when my daughter's, I mean, maybe she won't even be a grandma by that time. Maybe it'll be
Mm-hmm.
sooner rather than later. But looking
Sure.
back, and her grandkids will be like, "My grandma had CMV." It's almost saying like, "My grandma had cholera" or
Yeah, yeah,
something
yeah.
like that.
Yeah.
From we don't hear about anymore. So that's the goal, and I think the vaccine is really going to be key in reducing the number of cases of CMV that we see every year. So it's really exciting times. I
Yeah.
joke, I'm like, it is a hot time for CMV right now.
Mm-hmm. It only feels more and more well known. I think
Mhm.
I it's less and less shocking to students and things the more I feel like I talk about it now. And maybe that's just the space, maybe it's just the bubble I'm in, but definitely it feels, a lot more discussed. I feel like every time I go to a conference, there's at least one talk dedicated to CMV research. So it just
Yeah.
feels like it's more and more just becoming a part of our typical discussion, at least in the audiology world. If you wouldn't mind kind of finishing up, telling me a little bit about kind of what's been going on with Dr. CMV mom. How's that going
Sure.
juggling, your research life, parent life as a physician, and then also like social media? That's probably a really fun
Yeah.
thing to have to juggle.
Well, I love the social media because I just spout off. Sometimes I feel like it's more mom advice than practical medical advice or just
Uh-huh.
like hot tips about CMV prevention. But it's really fun to make just those videos and little snippets to get the word out there to try to start to demystify things.
Yeah,
There aren't a lot of CMV platforms out there, and so I
sure.
just thought anything that I can do. I've been really open, like I said, with sharing my story. And, sometimes I reflect, that's my daughter's privacy. That's my daughter's healthcare. It's
Sure.
really intimate things about our family. But at the end of the day, I just feel like she has a story and we have a
Hmm.
story that needs to be told because
Yeah.
it could potentially help people. So while I am naturally more of an introvert, I try really hard to get out there on social media.
Yeah, I think you're absolutely crushing it. And also, just if it
Aw.
affirms you at all, you all sharing this story, it's not even like maybe, it's definitely, impacting families and the potential for so many babies out there who otherwise families maybe would have never heard until, the Dr. CMV mom reel popped up on their page and they're like, "Oh my gosh, I definitely should not have licked that pacifier tonight. I am glad she told me that. I didn't even realize this was a thing." So I think that work is really, really important. I think it's such an underutilized tool in healthcare, and I'm a huge proponent for using it to share information. So I think the work you're doing is great. I hope you continue to do it.
Aw, thank you so much. I need to get on TikTok because, that's where
Good
the
luck.
moms are now. I know.
It's
I
true.
know.
It is where the moms are now, but I don't even know where to tell you to start there.
Yep.
You're gonna have to learn like some new dances or songs or something if you really want those to take off.
Totally. Yep.
Awesome. So if people wanted to reach out if they had further questions, is that maybe the best way to get in touch?
Yeah, absolutely. You can just send me a direct message. So it's Dr. DrCMV Dr. CMV Mom on Instagram.
Hmm.
And that's the best way to get in touch with me, and happy to connect with any families or answer any questions that I can. I can't give medical advice out of state, but I can give general educational tips. And
Totally.
usually that suffices.
Yeah, it's worth following just for that alone, honestly. The stuff you share is great. And then also the National CMV Foundation, I feel is pretty active as well. They do good infographics and things. Is that at National CMV?
Yep, exactly. At National CMV. And we have Community Alliance chapters in 42 states now. So
Wow.
we've got a really widespread and a lot of, amazing family advocates working out there.
That's great. Well, I'm so excited to see what is in the future for CMV research and treatment. And I'm so grateful for the work y'all are doing and excited to maybe have you back on when the vaccine is announced at some point in the
Yes,
near future. That'd
yes.
be
Let's
great. And when we have some
let's
results
do
there, what
it.
do you think?
I love that. Hashtag make CMV the next rubella.
Yes, please. I love it. I love it. Well, thanks again for joining me. It's been great talking to you.
Such a pleasure. Thanks for having me.
And that's all for today. Thank you so much for listening, subscribing, and rating. This podcast is part of a course offered for continuing education through Speech Therapy PD. Check out the website if you'd like to learn more about the CEU opportunities available for this episode, as well as archived episodes. Just head to speechtherapypd.com/ear. That's speechtherapypd.com/EAR. Do you enjoy listening to On the Ear but wish you could earn ASHA CEUs for it? Start today. SpeechTherapyPD.com has over 175 hours of audio courses on demand with an average of 19 new audio courses released each month. And here's the best part. Each episode earns you ASHA Continuing Ed credits. Oh, no, wait. This is the best part. As a listener of On the Ear, you can receive $20 off an annual subscription when you use code EAR21. Just head to SpeechTherapyPD.com to sign up and use code EAR21, EAR21, for $20 off your annual subscription.